We're having about 130 to 140 cases reported each day over the past week, which is about 3.5 times what we had in early June. This represents about 83 cases per 100,000 residents over the past 14 days, approximately 1,000 cases reported each week. It's also important to note that reported cases are only a fraction of all cases. Our colleagues at the Institute for Disease Modeling estimate that there were between 2,600 and 7,400 people actively infected with COVID-19 on a single day, August 10th, with the best guess around 4,500. So reported cases are only a fraction of all cases. That's the message. The effective reproductive number, which tells us whether our outbreak is growing or shrinking, is above 1. It's been above 1 for much of our outbreak, and it's currently telling us that the outbreak is growing. Hospitalizations and deaths are relatively stable, but have increased since mid-June. Each week, in most of June, from the middle to July, we were seeing about 5 to 9 deaths, single-digit numbers, but we're now seeing high teens over the last 3 weeks per week. Most of our deaths still are associated with long-term care facility residents who are greater than 80 years of age.
And Jeff, I'm going to have you stop for just a moment. The audio wasn't quite working on your end, so I'm going to have you start that again to make sure that the media can get that and the public. So if you can begin again.
From where?
From the very top.
Ooh, the whole thing. Okay.
The whole thing. Thank you.
Okay. So thank you for joining us today. I'd like to provide an update on where we're at in King County with COVID-19 and some cautionary words as we head into the fall. So COVID-19 transmission and cases in the county remain too high for comfort, and this is representing an ongoing and significant challenge as we head into fall. As of this morning, we've had 18,381 cases and 705 deaths, regrettably, among King County residents. We're having about 130 to 140 cases reported each day over the past week, which is about 3.5 times what we had in early June. This represents about 83 cases per 100,000 residents over 14 days, approximately 1,000 cases reported per week. Now, it's important to understand that reported cases are only a fraction of all cases. Our colleagues at the Institute for Disease Modeling estimate that there were between 2,600 and 7,400 people actively infected with COVID-19 on a single day, August 10th, with the best guess around 4,500. So the point is that what you see in the official numbers only represent a fraction of the actual number of people who have infectious COVID-19 in the community. The effective reproductive number, the R number, R sub E, represents whether our outbreak is growing or shrinking. And when it's above 1, our outbreak is growing, and that's where it is currently, 1.15. Hospitalizations and deaths are relatively stable recently, but they have increased since mid-June. At that time, we saw mostly single digits, 5 to 9 deaths each week through mid-July. But over the past couple of weeks, we've been seeing numbers in the high teens each week. Most of our deaths remain associated with long-term care facilities and residents above 80 years of age. Hospitalizations have also been increasing over the summer. Over the past 4 weeks, where we have complete data from July 19th to August 15th, there have been 181 hospital admissions among King County COVID cases, compared to the 4 weeks prior, where we saw 155 admissions. Hospitalized cases are relatively stable over the summer, but they have been increasing. We know that our King County hospital census has increased from about 80 cases in King County hospitals in May to about 125 currently. And the median age over the last 2 weeks of hospitalized cases has been around 62 years of age, which is slightly older than the median age that's been observed throughout the outbreak overall. We continue to see higher hospitalization rates among older age groups compared to younger age groups, and there have been no trends in the racial and ethnic disparities that we've reported on previously. We have experienced an increasing number of cases and investigations associated with social activities, and I really want to spend a few minutes on this. We've also seen a number of cases increasing in homeless settings, in long-term care facilities, and in workplaces over the summer. And I'll share with you some data. Our long-term care facility investigations have increased from about 4 per week in June to 12 to 15 per week in July. We have 8 or 9 per week so far in August. Among homeless congregate living settings, we saw 0 to 2 per week in June, and now experiencing 3 to 6 per week in July. And our non-healthcare associated workplace outbreaks have increased in July. We've seen 72, and we've had 25 so far confirmed in August. In the last 2 weeks, we've had almost 200 businesses identified as having 1 or more people with COVID-19 who are working while contagious. We don't have long-term trend data because we have started to take these business reports and done our workplace investigations in June. But the number is increasing over time throughout July. And part of this is probably due to the governor's directive requiring businesses to report, and we're happy to be getting those reports and providing assistance and decreasing the risk in workplace settings. We've also had many cases that have been reporting recent socializing, social events including parties, graduation parties, weddings, gatherings with friends and families, travel, group recreation, camping, lots of socializing without using masks and without using social distancing. And our social gatherings have been reported most commonly, but not exclusively, among younger people, people in their teens and 20s. Again, we've had outbreaks and cases reported at weddings, graduation parties, barbecue-associated cases, people who've returned from travel and vacations, social gatherings with friends, recreational activities. And these are largely occurring in social networks of friends who do a lot of things together and have a lot of exposure. So we can infrequently pinpoint the exact location of transmission. But what I can tell you is there are many opportunities in the community because of the increased activity and socializing for COVID-19 to be spreading. So one of my messages today is to please remember that there is a relatively high level of COVID activity in our community. There is risk associated with all gatherings. If you do have a gathering, please make it small, do it outdoors, and look for guidance on how to do it safely. There's guidance on the CDC website that talks about having graduations and outdoor events and going to the beach and other things and how to do that safely. I want to be clear, though, that the level of transmission currently and the number of cases in our community does represent a significant risk for infection throughout every corner of our community. And the rate is too high to bring schools back for in-person learning. This is especially concerning because we expect COVID-19 to get worse in the fall and winter, and people to spend more time indoors when coronavirus and other respiratory diseases typically are more common and spread more readily. The best thing we can do to get back to school, to get back to more economic activity, and to decrease the danger from a second outbreak wave this fall and winter is to get COVID activity levels as low as possible now. So again, we need to recommit to our COVID-19 prevention basics. We need to understand that the risk is present and pervasive throughout the community. We need to think long-term about behavior changes and environmental changes that allow us to live more safely in this time of COVID. And we need to decrease the number of activities outside the home, the number and duration of contacts with others, and take distancing and mask use seriously. With respect to the upcoming fall season, please plan to get a flu shot for yourself and your family. COVID-19 vaccines may start to become available in late 2020 or 2021, but we won't eliminate the outbreak or the risk right away, even if they do. There will be healthcare workers and other prioritization groups getting the vaccine first, and it will take quite a while for it to get to everyone in the community who may be interested in becoming vaccinated. So COVID-19 vaccine is not going to be a magic bullet that's going to bring this outbreak to a screeching halt. Although if we do have safe and effective vaccines, they will be tremendously useful in bringing the outbreak to an end eventually. So with that, I think I'll stop and take your questions.
Thank you very much. For media, if you can share both your name and your outlet, that will be helpful for us. And we will start with Sandy Doughton. You are unmuted. Let's give it another minute for Sandy to ask her question. I know it gets tricky at the beginning here with mute.
Hi there. Can you hear me now?
We sure can. Go ahead.
Okay, thank you. Sorry about that. Hi, Jeff.
Hi.
What, if anything, is the county doing to increase the supply and accessibility of flu vaccine this year?
Thanks, Sandy. It's an important question because, although we can never predict, the severity of an influenza season in advance, the idea, the prospect, the potential for a severe influenza season or even an average influenza season compounding the COVID outbreak is very, very disturbing and worrisome, should be for all of us. I mean, there's preventable hospitalization and death from influenza. We don't really know what the interaction between these two diseases may be. And it certainly will be tremendously confusing to have many people with influenza illness, which can look just like COVID at the beginning, and will need to be tested and isolated and quarantined if they develop influenza, as if they had COVID until COVID can be ruled out and eliminated as a cause of their symptoms and illness. So we very much want to promote increased flu vaccination in the community. So what we will be doing is increased public communications, increased marketing, increased outreach with our community healthcare providers, our community clinics, and our healthcare facilities to try and get the message out about the importance of flu vaccine, including today's briefing, to try and raise the awareness now early, and to make sure that all of our healthcare providers have as much flu vaccine as they can use. And we do believe that there's going to be plenty of flu vaccine available through the usual channels, this vaccine, but our federal colleagues at the CDC have purchased extra vaccine through the public sector. We'll be getting extra doses of vaccine if they're needed through the public health system so that we can do the outreach that we're planning in environments such as congregate living for people experiencing homelessness and for long-term care facilities and for other high-risk settings. So in the next couple of weeks, we'll be rolling out an influenza vaccination campaign on a number of fronts, both to engage with healthcare providers in the healthcare community, also the public, and also outreach to vulnerable communities and our contacts that we've been working with on the COVID outbreak, as well as those that we typically engage with during the flu season, to try and reinforce the importance of getting flu vaccination this year, in addition to what we typically do. And, one of the things that's important for people to understand is we all know flu vaccine is not perfect, but it's extremely useful. It can prevent hospitalization, it can prevent death, and it can prevent people from having an illness that can be confused with COVID-19. So we really encourage all children, all adults, people with underlying health conditions, and families to please make every effort to get vaccinated this season.
Thank you. And there was a community question actually from the UW as a follow-up. Is there any estimation yet about the effectiveness of the flu vaccine this year?
No, unfortunately, flu vaccine effectiveness is one of those things that we learn after we've used the vaccine. Once we see how well it works in the real world when the flu virus is circulating. So we hope to not have a severe influenza season. That would be ideal. But again, we can't predict how severe the season will be or how effective the vaccine will be in advance. Typically, the vaccine on average is about 50% effective in preventing any influenza illness across all age groups. It's more effective in young people and children, and it's more effective in preventing hospitalization and deaths in older folks. So even though people may develop influenza, which leads to that 50% number, because the flu itself is not prevented. Serious influenza is prevented, hospitalizations are prevented, and deaths are avoided. So it does vary from year to year, and we'll know more as the season progresses.
Great, thank you. And we'll take some more follow-ups on that, but let me make sure to get to a few other questions. Anna Boyko-Ryrock, go ahead.
Hi there. So since the risk of getting COVID is so much less when you're outdoors, why shouldn't we all be getting our socialization out of the way now before what's probably going to be a very long, dark, and lonely winter for a lot of people?
I think it's really great to get our socialization out now as safely as we can. And outdoors is definitely safer than indoors. What we're seeing, despite that fact, is maybe a lack of appreciation of that fact. And we know that there have been many indoor gatherings, indoor parties with large numbers of people at times, and even outdoors where the risk is much lower. Much lower because of the natural ventilation and the sunlight. Sometimes a prolonged close face-to-face contact still happens, and that is unsafe, whether outdoors or indoors. So socializing is okay, but really to be safe, it needs to be done in small groups, and ideally with few people outside the home. But if it's going to be done in larger groups, it needs to be done safely. And that means, still maintaining the distance, not sharing personal items like food utensils, drinks, soft drink containers, anything that goes hand to hand theoretically can be contaminated with the virus and increase the risk for infection. So we want people to be, to get necessary and important social interaction. We just want it to be done safely. And large gatherings that we know are happening for many reasons, parties, celebrations, graduation parties, weddings, large recreational events, and so on, present a risk when people are not obeying that, 6-foot rule, and when they're sharing a space and other things amongst themselves. So bottom line, yes, socialization is important. We want people to socialize. Outdoors is definitely the way to do it, and it still needs to be done safely.
Thank you. Dave Wagner, go ahead. Looks like Dave may have fallen off, so we'll get work to get you back on. Another question from the community about schools. So the question is that some school districts are planning on bringing some students back, particularly students with disabilities, and I'm assuming that means back in person, English language learners, to do some in-person instruction in just a few weeks. What is your advice about this? Is public health advising against this?
Well, we understand that this is the most difficult issue facing us in the context of the COVID-19 outbreak, the issue of bringing our children back to school, because school is so important for so many reasons, for education, for mental health, for socialization, for behavioral health, and for the special needs students to get their needs met, and also for food in some cases. So we do want to support getting those critical services met. And I think it's unsafe to bring all students back now, given the level of disease that we're seeing in our community, but bringing small groups back, particularly when we get under 75 per 100,000 over 14 days, and we're getting close to that cutoff, can be done carefully, should be done extremely safely and in compliance with all the safety guidelines that have been issued by various organizations, including the CDC, the American Academy of Pediatrics, and the National Academy of Medicine. Lots of very good and important guidance about keeping children cohorted in small groups, not allowing mingling, cohorting with single teachers, using social distancing in the school environment, screening for ill people, quick identification and exclusion of students when they become ill, using masks and other barriers to decrease transmission whenever possible, good hand hygiene, good environmental care, and paying attention to ventilation in the school setting. All of these things will decrease the risk. It's very, hard to be dogmatic about, fine hair splitting on the number of cases in the community that would make it unsafe, given the tremendous, risk of staying out of school and the risk of entering school at the same time. And I think each school community, the parents, the school administration, the teachers, and the staff that work in that school need to make a decision on what's right for their school community based on the level of risk of COVID-19 and the level of risk that their students are experiencing by staying out of school. So when we go back to school, clearly, we want to start with the youngest learners for whom in-person education is most important. We want to start with those students for whom special services are critical and who need those services and who are not getting them, including food, behavioral health services, and physical therapy. And we want to do it in a very careful way and be able to recognize when we're being successful and when we need to change course because the risk is too high. But again, this is a very a situation that's fraught with uncertainty and is unpredictable to some extent, and we need to just go very carefully, learn as we go. And from my perspective, I think there's room for some flexibility based on the values and risk of the individual school community.
And I'll go ahead and read Dave Wagner's question from Cairo 7 if he's having some audio challenges. So David's asking, how do you monitor the success of compliance when it comes to the public wearing of masks? What standards do you use to determine success?
Yeah, this is a very good question and one we've been thinking about. We don't have a good measurement of compliance with mask use. I wish we did. We don't really know what proportion of people are wearing masks every day and are they wearing them under the right circumstances. Our gross indirect measurement of compliance with mask use is confounded by compliance with social distancing, because we know that the single most important measure is staying away from other people, decreasing interactions outside of the home, limiting the duration of those interactions, and limiting time indoors in poorly ventilated spaces. And so, that's happening at the same time to some degree as mask use is happening to some degree, and we don't have really good ways to sort that out. We have some information. Our colleagues at the SCAN study, with whom we collaborate on understanding the prevalence of COVID-19 in our county and risk factors for disease, have been asking questions about mask use, so we have some information from a cohort. It's not necessarily representative, unfortunately, of all the residents in the county, and it's frustrating not to be able to pinpoint and have our finger on the pulse of mask use. We have anecdotal experience from what our investigators learn when they do case reports. We know that many people who have COVID report being in environments where mask use is not happening, such as the social environments and parties and gatherings. So I think there's clearly lots of room for improvement in mask use. We also, we can see outdoors where people are wearing masks and where they're not, although as we all know, mask use is most important in indoor settings. But if there's going to be face-to-face contact in outdoor settings and people are going to be closer than 6 feet with groups outside the family, we clearly recognize the importance and recommend masks be used in that setting as well. But we don't have a very good way to measure it currently.
Here's a question from Carla Johnson from AP, and I'll go ahead and ask it for her as well. So Carla's asking, or pointing out that Colorado makes public lists of names of workplaces, restaurants, bars where case clusters are being investigated and makes that public. Is that level of detail something that King County or the state is contemplating making public?
I can't speak for the state. We are going to be putting a public dashboard around workplace investigations and other outbreaks. It's just for us a large consideration is limited resources in our analytics and information teams, and just being able to develop these dashboards and make sure the data is posted in a user-friendly and reliable way. But that is definitely on the runway. We will have a dashboard for workplace investigations. We're inclined to, at this point, report by type of workplace rather than naming individual workplaces, because we deal with these workplaces during our investigations, and they've been very compliant overall, and helping us inform both the employees and improve any practices when we identify that. But in general, we see great benefit in reporting the data on where transmission is occurring in the community, and look forward to getting our dashboard up pretty soon.
And I'll just add, currently for restaurants, we have a STAR, what's known as the STAR team, which is the Safe Start team that's going out to help educate restaurants on compliance. If a restaurant is out of compliance and needs to close, we do publicly release that information, and you can look on our website for that.
Yeah, one thing, just to follow up on that question, one thing to understand is that when we identify a workplace or a restaurant or any other venue where there have been COVID-19 cases, it's very difficult in most instances to know what the role of that venue is in transmission. Clearly, there are people who have COVID-19 at that facility or at that restaurant or at that workplace, but whether that workplace in any way is responsible or contributes to the transmission of the disease is very, very difficult to determine at this point, because we've got so much widespread disease in the community. As I've told you, there are thousands and thousands of people with active COVID infection every day in our community. And they're going in and out of workplaces, they're going in and out of restaurants, they're socializing with one another, because don't forget, people with COVID-19 spread this infection before they look or feel ill. So that makes it very challenging. So we don't want to get into a situation where we're giving people the impression that COVID-19 is being caused by or even facilitated by certain locations just because we've identified cases in those locations. We absolutely know that socializing and indoor gatherings transmit COVID, and it's a very important thing to understand that and to avoid prolonged activities with others indoors for social reasons, whether it be at a party or for a retail purchase or for any reason. And, indoor dining represents a higher risk than outdoor dining, for example. But when we have so much disease transmission in the community, simply identifying cases, even if there's a cluster of cases in any one venue, doesn't necessarily tell us what the role of that venue is in causing those cases.
Thank you. Will Stone, you can ask your question.
Great. Thank you so much. I have a question about gyms, and please forgive me if you've already addressed this, but obviously there's a lot of frustration with some gym owners, especially smaller places. As we head into the fall, it's important for people to get exercise. And the gym owners say there isn't a lot of data to show that we've had a bunch of outbreaks at gyms around the country. Can you address that question?
Yeah, thank you. The concern around gyms relates to a couple of things. One is that we know COVID-19 is more likely to be transmitted in indoor locations. It's also more likely to be transmitted where people have more prolonged interactions. So, longer you're in a place with someone else who may be infected, the more likely you will be to acquire COVID-19. And then the third factor is we know that exercising, heavy breathing contributes to transmission of COVID-19. So there are three important unfortunate factors that increase COVID risk that are all present in gym locations. I am a very strong proponent of physical activity for health. And I very much miss going to my gym. I mean, I was there 3 or 4 times a week before the outbreak, and I haven't been back. And I want to get back as badly as anyone, believe me. We are, in many aspects of the COVID outbreak, using limited available information to make the best public health decisions we can. And there have been a number of outbreaks reported from around the world related to gym facilities. And we know that the enclosed environment, the prolonged nature of contact, and the exertion all increase the risk. So for those reasons, there are more stringent requirements placed on those facilities. I'm very sorry to say, and I look forward to the day when we can relax them. And again, I really want to emphasize that the most effective and important thing we can do to get those gyms and other businesses open is to decrease the level of COVID transmission in our community overall. If we can suppress the number of cases down to a lower level, the risk of acquiring COVID-19 or encountering someone who has COVID-19 in a gym, in a retail outlet, at a birthday party, in your home, will be much less than it is now. When we've got relatively high levels of COVID transmission in the community, the risk is high in every venue, including gyms.
Thank you. And Sandy, did you have a follow-up question?
Sure, I can always ask another question.
Okay, I'm sorry. I thought you had raised your hand. Go ahead.
So Jeff, there's been these couple of intriguing preprints out there suggesting that the flu vaccine might actually have a protective benefit against COVID. Does that make sense to you? What do you think of that possibility?
Well, I like the idea, and it would be great if the flu vaccine had a protective benefit. There's so much we don't know about COVID right now. We don't exactly understand what predisposes people to severe infection, and what protects others from infection at all or severe infection when exposed. The immunological response to COVID is extremely complex, and clearly there are things that are present in one person that are different in others that determines the severity of illness, along with other things like perhaps the inoculum. There are some theories that suggest that nonspecific activation of the immune system through something like an influenza vaccine or other stimulation of the immune system could have an impact on someone's susceptibility to COVID-19. And I would be thrilled if it turns out that influenza vaccine, or even influenza infection for that matter, would decrease someone's risk for having COVID-19. But at this stage, it's just not possible to know with certainty whether influenza vaccine or other infections or what, if anything, in someone's immunological history or makeup might be either predisposing them to more severe illness or protecting them from more serious infection.
Thank you. And I know we're running up on time, so we'll just take 2 more questions. One community question: if we continue to see exposures happening because of household contacts, and across the epidemic, that seems to be a consistent theme, is there more we need to be doing to prevent household contacts from transmission happening, such as more INQ, or how can we get on top of that piece?
Yeah, thank you. Important question, because the vast majority of our cases, are reporting household contacts as the number one exposure risk. Now, of course, those household contacts got infected somewhere in the community. I mean, if everyone always stayed in their household, we wouldn't have a problem. So we know that people get infected in the community, they bring it home to the household, and then COVID is spread very effectively in household environments. What we need to do to decrease household transmission is to get community transmission down. And what that means is really, again, reinvigorating our efforts to prevent COVID and our individual steps that we can take to prevent this disease from transmitting. There are steps that all of us can take as individuals and that we need to take as business owners and in every environment, such as recreational environments, social environments, and workplaces. And that means understanding the critical importance of limiting the number of interactions with others, decreasing the duration and proximity of those interactions. So decreasing both the time we spend with others and how close we get, keeping that social distancing at 6 feet, and remembering anytime when we're outside of the home and in contact with others, particularly in indoor environments, to wear a face mask if we're going to be within 6 feet of other people. Those are the only things we have at our disposal right now. The distancing, the decreasing our activities, and using face masks, along with good hand hygiene and common sense environmental cleaning. That is all we have at the moment to get this disease under control. And if you look at every other country in the world, it works. We just need to commit to do it. If we have the will, we can decrease COVID transmission in our county, in our state, and in our country. And when I say decrease COVID transmission, I mean decrease COVID transmission everywhere, in the household, in workplace environments, and allow us to get back more safely to things like recreational activities and gyms and social gatherings. But we have to understand that this isn't going to happen unless we, each of us as individuals, take the necessary steps to decrease COVID transmission among our personal social networks and in our personal work environments. It's not going to go away. I'm very concerned that COVID-19 is going to get a lot worse this spring. I'm very concerned that COVID-19 is going to get a lot worse this fall and winter. And I would be very happy to be wrong about that. But it would be very irresponsible if each of us was not preparing for that possibility by doing everything we can do now to decrease COVID-19 transmission and thinking what we will be able to do, how we will cope if this disease gets a lot worse in the coming weeks and months.
Thank you. And we'll take one final question from Charlie Harger. Go ahead.
Yes, Dr. Duchin. The Seahawks have already announced their first 3 home games will not be played in front of fans. How difficult will it be as we get deeper into the fall for them to have any games in front of fans, even at reduced capacity? Additionally, would it be wise for the team to play?
Yeah, well, I think it's a difficult question to answer because I can't predict where we're going to be, throughout the entire fall and winter. But I can tell you that right now, I think it would be very unwise to play in front of fans because, the reason I'm here talking to you is because we're having difficulty with the level of transmission in our community, resulting in too many illnesses, hospitalizations, and deaths. And so we're going in the wrong way, right? Our outbreak is growing right now. And in order to think about doing things that would increase the risk of transmission, we need to get the level of disease way down before we can start thinking about doing more. What we need to be thinking about now is doing less and doing what we're doing much more safely. And once we get success in managing COVID and suppressing the number of cases and decreasing transmission and getting the number of ill people, hospitalized people, and deaths down to a lower level, then we could think about how to, again, start to increase our activities in a responsible way. We saw that, when we responded to our initial outbreak with the stay-at-home order and very, very good compliance with limiting our interactions with others, we suppressed our transmission down to about 40 cases per day in King County. We're now up to over 3.5 times that, and our outbreak is growing. So we know that we have the tools and the ability to decrease transmission. But with a growing outbreak, I certainly can't see bringing people into environments that would actually further increase the risk of transmission and accelerate the pace of this epidemic in our community.
Thank you. Any final words before we wrap up?
Not for me, no. I'd like to thank everyone for joining us today. I really appreciate your interest in helping inform the community about the state of this outbreak and providing a reality check on the fact that it's still alive and well, and we have a lot more that we can do and need to do to bring this outbreak down to a level that will allow us to do the things we really want to do more safely, and that will decrease the risk of us having a very, very challenging time this fall should the outbreak accelerate dramatically, as many fear it will. So, again, staying away from others to the extent possible, decreasing the number of activities outside the home, taking very good care to make sure that social distancing of that 6 feet and mask use are used, and limiting interactions with others to the extent possible will still allow us to have significant progress before that fall and winter season comes, where we may be seeing some very, very challenging times. So I encourage everyone to double down on their COVID-19 prevention efforts in the next couple of weeks.
Thank you. And just to reiterate Jeff's point, I appreciate the media joining us today and members of the public. I also want to point you all to publichealthinsider.com. We have some recent blog posts about social distancing and what are some of the rules and how to limit gatherings under 5. So you can check that out on our website, as well as information about some of the newer efforts going on to help support restaurants and businesses to operate safely. So feel free to check that out. And with that, I'll wish you all a very good afternoon.
Thank you, Sharon.
Thank you.
Thanks, everyone.